and welcome back to Dr. Showcase. So today I'm going to be talking about one of my favorite topics, which is perimenopause and the menopause. So today we're going to be looking at definitions, symptoms, and the health implications of this period in a woman's life. So let's start with definitions. What is the menopause? So it's 12 months without periods. It's when the natural menstrual cycle comes to an end. Now, the perimenopause is a period of transition from that normal menstrual cycle that most women get monthly, although there are variations to this, and that period in time when those periods stop for that 12 months in total. So it affects all women or people assigned female at birth. And really, it's very important because there are certain implications, and we'll get to that in a minute. Now we're just going to talk about the causes of the menopause. So the most common is obviously that natural decline in reproductive hormones, which happens to most women. Generally speaking, this tends to happen starts to happen in the mid-40s and comes to an end generally by the mid-50s for most women, but we'll talk about the fact that this can be different for certain women. Now, it can also happen surgically when someone has an oophorectomy, which is the removal of their ovaries, because that means that there's no more, because those hormones are produced by the ovary, so that means that they no longer have those hormones produced, and therefore they go into surgical menopause. And also people who have had treatment for chemotherapy and radiotherapy for cancers sometimes do experience this as a result of the treatment that they've had. We also have this condition called primary ovarian insufficiency, and to be honest, this cause deserves its own attention. But what happens here is that women have an earlier than expected decline in their reproductive hormones, and basically go into an early menopause. And there's a variety of causes for this, but the most common is actually idiopathic, in that we don't know why. But as I say, this deserves its own attention, but it's important, and we'll talk about this a bit later on. So what are the signs and symptoms of the perimenopause and the menopausal state? Now, some of these symptoms come and go, and that's because particularly during the perimenopause, there is a fluctuation in hormones. So as the estrogen in particular is decreasing, it doesn't just go down in a linear fashion. It almost kind of goes up and down as it decreases. So a very common symptom is vaginal dryness, leading to painful intercourse. Also, temperature dysregulation. And some women then feel inappropriately hot or cold, and this can lead to hot flushes, which everyone seems to know about, but really only 20 to 30% of women actually experience this symptom. Chills is another common symptom that women get, and night sweats. Other symptoms include problems with sleep, mood changes, brain fog, and concentration problems, such that women sometimes have difficulty with word finding. And for women who are in the workplace, this can often be quite difficult because they're struggling to cope and they don't know why. Also, weight gain and a slowed metabolism. So women may notice that they start to gain weight around the abdomen, and that it's more difficult to lose weight. Also, you can get loss of skin elasticity, and that leads to drier skin and also drier hair. Women can experience joint aches and pains and breast changes. These are just a few of the symptoms. There's a whole range of them, but these are a few of the main symptoms that women experience. Now, what are the impacts of the symptoms? Now, the first thing is that, as I said, there's a wide range of symptoms that can occur during the perimenopause and the menopause. And some women actually have no symptoms, and some women are overwhelmed by symptoms. There is such a variation in what we see. And as I say, symptoms can come and go. Now, what I've noted in my clinical practice is that the mental load that a woman carries can impact her experience of the symptoms of the menopause, but also, crucially, her ability to cope. And of course, I spoke about the mental load in the previous talk that I did. And if you haven't watched that, please do, because that will really help you to understand what I mean by that. Then finally, there's this thing that we observe, which is that generational trauma can lead to more severe menopause symptoms. And this is best seen in Black women who we know have an earlier menopause in comparison to white women, but also tend to have stronger symptoms and more difficult to cope with symptoms. Now, what are the complications of the perimenopause and menopause? Well, because of this estrogen deficiency state, as the estrogen drops, women are at an increased risk of heart and blood vessel disease in the postmenopausal period. And therefore, in a way, we see the perimenopause as this window of opportunity where cardiovascular risk can be really thought about and managed properly. Now, also, there's an increased risk of cognitive decline and dementia in the postmenopausal period. And this is not fully understood, although we have some inkling as to why that is. And we know it is related to estrogen deficiency in the postmenopausal period. But there's a lot of research still ongoing about this. And another thing that we see definitely is this increased risk of osteoporosis, which is the thinning of bones, which can lead to serious bone fractures in the perimenopausal and postmenopausal states. We also see this condition, which is not as often spoken about, but is crucial to a lot of women, which we call the genitourinary syndrome of the menopause. And it includes vaginal irritation, urge and stress incontinence, urinary discomfort, and recurrent urinary tract infections. Now, women are already predisposed to urinary tract infections just because of our biology, that the anus is quite close to the vagina. But things are amplified in the menopause period. And many women who've already had children and carried children, who might already have problems with their pelvic floor, might find that this is exacerbated in the perimenopause and menopausal period. And they don't talk about it, but often they have these worries, and they can feel quite embarrassed about it. And really, we would urge such women to seek help, because there's a lot that we can do to help with those symptoms. And leading on from that, a lot of women experience sexual dysfunction, and that includes painful or uncomfortable intercourse and or decreased libido, which is the interest in sex. And this again is something that we as menopause specialists can help with as well. Now, what happens with the bleeding pattern in perimenopause in particular is very different for each woman. Now, some women might find that they have lighter periods, but actually for a lot of women, they find that they have this variation. So they may have periods with no periods for about 2 or 3 months, and then they have really heavy and sometimes also painful periods. And then also, if women have fibroids, this can get worse, and this is particularly notable in Black women as well. And this heavy bleeding can be very problematic, as women who then suddenly have difficulty in the workplace, and the pain, the dysmenorrhea, and it can really be quite difficult to manage. And again, obviously, this can cause things like anemia and lightheadedness and dizziness and fatigue. So if you have that, it's also a reason for you to seek help, because there's a lot that can be done. So moving on, tips to ease symptoms. So very importantly is increasing physical activity. And this helps in so many ways, because it helps with improving mood and ability to cope with the symptoms. Also, it helps to keep you healthy because of all those other risks that we discussed, in particular the cardiovascular risk, the joint problems and things like that. And different types of exercises are necessary at this stage. So there's cardio, obviously, for the cardiovascular, and that's things that increase your heart rate. But there's also strength building, which is mostly resistance exercises such as weight building, weight carrying, and things like that. But also things that are good for flexibility. And I often say things like Tai Chi, Pilates, yoga. So it's really good to try and get a mix of those into your physical activity routine. You don't have to go somewhere. There's so many resources on YouTube and so many apps that you can use, especially for women who are time poor. Now, also, as I said, the mental load is really, really important. You need to review your mental load and aim for a manageable amount. And we've obviously talked about this in more detail in the previous talk. You need to prioritize things, what is important, and anything that isn't, you need to really try and be kind to yourself and really leave that. Quit smoking if you do. It's important to eat well because your diet really impacts the experience of the symptoms, and there's certain foods that can make things worse, particularly processed foods, and things that can really make the symptoms less tolerable. Then we always say take a vitamin D supplement, and I'd add to that to make sure that your calcium intake is replete. So if you have a dairy-free diet, then you need to calculate or take a supplement or calculate whatever dairy alternatives that you're taking to ensure that you're getting an adequate calcium intake. And there is actually a calculator that you can use to do that. Also consider carrying a portable fan if you experience hot flashes, and this is particularly relevant during the hot weather or people who live in hot countries. And then strengthen the pelvic floor muscles using pelvic floor exercises, sometimes also called Kegel exercises. And you can do that by yourself, learning those, or you can get help from a women's health physio. Again, we talked about this: spicy, fatty, and processed foods, alcohol, caffeine, all of those things can make symptoms worse. So really be careful of your intake with that. And then also, crucially, have a positive perspective about the menopause. I know a lot of women fear the menopause because it gives sort of a sensation about, oh, I'm getting old, but actually I really see it as an opportunity to really try and live your best life. So yes, there are challenges, but actually it can be a very positive experience for a lot of women. Now, when do you need to see a doctor? So very importantly, menopause is not a disease, but it can be affected by the mental load that women carry. And also, women may struggle to cope with the symptoms. Therefore, if you have symptoms that are influenced by your heavy mental load, or you're struggling to cope with the symptoms, even if your mental load is not particularly heavy, you need to seek help. Also, high-risk individuals, and in particular, that's women who experience perimenopause under the age of 40. So that's what we would usually describe as people with primary ovarian insufficiency, or women between 40 and 45, because those women would be at higher risk of the complications of menopause. But also, if you have a personal family medical history, that puts you at higher risk of some of those complications, such as heart disease or osteoporosis, all of those things, that you really need to consider having a conversation with a medical professional about whether you need treatment. And also women who have sort of heavy bleeding and things like that, that's impacting their day-to-day lives. Now, as I say, please do not hesitate to seek medical assistance for your symptoms, because there is help. This is why I've gone into this work, because I want to help women cope with some of the symptoms which can be quite challenging. So in conclusion, perimenopause and menopause have diverse symptoms with potential health implications. So if you are experiencing symptoms and struggling to cope, please seek help and book a consultation with a healthcare professional that knows about this. And to be honest, most UK GPs should be able to provide at least some support with this. Now, but obviously, if you need that extra help, there are people who have done additional training to become more specialist or have a special interest in the menopause. Now, understanding these can be potentially life-changing for your current and future health. So it's important to bear that in mind. Now, we will obviously be having future talks with more detail on the treatment options for the perimenopause and the menopause. This was just a talk to introduce the concept and the symptoms. You can also join our doctor shows list to find out more about our upcoming online perimenopause and menopause clinic that we're looking to start potentially towards the end of this year. But as I say, there are loads of people who have knowledge in this, and you can go onto the British Menopause Society here in the UK to find a reputable specialist or speak to your GP. Most GPs these days know quite a bit about the menopause. Right, so that's it for this session. I will be seeing you next time on Dr. Showcares. Thank you for listening. See you then.